Nanotechnology is a rapidly evolving field that has the potential to revolutionize the field of medicine. By manipulating matter at the atomic and molecular scale, scientists and researchers have been able to develop innovative solutions for a wide range of medical conditions. One area in which nanotechnology has shown great promise is in the field of gastrointestinal disorders. Gastrointestinal disorders, such as gastroesophageal reflux disease, gastric ulcers, inflammatory bowel disease, and colon cancer, pose significant challenges in terms of diagnosis and treatment. However, with the use of nanomedicine, we can explore novel approaches to address these challenges and improve patient outcomes. Gastrointestinal disorders encompass a wide range of conditions that affect the digestive system, including the esophagus, stomach, small intestine, and colon. These disorders can cause significant discomfort and can lead to both acute and chronic complications if left untreated. Nanomedicine, the application of nanotechnology in medicine, offers unique opportunities to enhance diagnostics, drug delivery, and therapeutic interventions in the field of gastrointestinal disorders. Nanoparticle-based drug delivery systems have gained significant attention in the treatment of gastroesophageal reflux disease, GERD, a condition characterized by the backward flow of stomach acid into the esophagus. Nanoparticles can encapsulate and deliver anti-reflux medications precisely to the affected area, reducing side effects and improving patient compliance. GERD is often treated with proton pump inhibitors, PPIs, that suppress the production of stomach acid. However, the conventional oral administration of PPIs can lead to variable drug absorption and off-target effects. Nanoparticle-based drug delivery systems, such as liposomes or polymeric nanoparticles, can encapsulate PPIs and enhance their bioavailability. These nanoparticles can be tailored to release the drug at the desired site of action, minimizing systemic exposure and maximizing therapeutic efficacy. Furthermore, nanoparticle-based drug delivery systems can be functionalized with targeting ligands that specifically bind to the inflamed esophageal tissues. By selectively delivering the therapeutic payload to the disease site, nanoparticle-based drug delivery systems hold great promise in improving treatment outcomes and reducing adverse effects associated with GERD. Gastric ulcers, caused by an imbalance between aggressive factors, like acid and pepsin, and protective factors, such as mucus and bicarbonate secretion, in the stomach lining, can lead to severe complications if not properly managed. Nanotechnology offers a wide range of diagnostic tools that can aid in early detection and monitoring of gastric ulcers. One such approach involves the use of nanosensors that can detect specific biomarkers associated with gastric ulcers. These nanosensors can be ingested orally and can travel through the gastrointestinal tract, providing real-time monitoring and accurate information about the ulcer's progression. This non-invasive and highly sensitive diagnostic technique can revolutionize the way we diagnose and manage gastric ulcers, enabling early intervention and personalized treatment plans. Inflammatory bowel disease, IBD, including Crohn's disease and ulcerative colitis, is a chronic condition characterized by inflammation in the gastrointestinal tract. Current treatment strategies for IBD often involve nonspecific immunosuppressive drugs that can lead to systemic side effects. By utilizing nanotechnology, targeted drug delivery systems can be developed for site-specific treatment of IBD, minimizing off-target effects and maximizing therapeutic efficacy. Nanoparticles, such as lipid-based carriers or polymeric nanoparticles, can encapsulate anti-inflammatory drugs and deliver them precisely to the inflamed gastrointestinal tissue. These nanoparticles can protect the drug from degradation in the harsh gastric environment and deliver it to the affected site in a controlled manner. Additionally, the surface of nanoparticles can be functionalized with specific ligands that target inflamed tissues, enabling enhanced drug accumulation at the site of inflammation. This targeted approach holds great potential in reducing the recurrence and severity of IBD flare-ups, improving long-term outcomes, and enhancing the quality of life for patients suffering from this debilitating condition. The small intestine plays a vital role in nutrient absorption and digestion, making it a crucial organ to monitor in gastrointestinal disorders. Traditional imaging techniques, such as endoscopy or radiographic imaging, have limitations in visualizing the entire length of the small intestine. Nanotechnology-based imaging devices offer a minimally invasive and efficient solution for intraluminal imaging. Nano-imaging devices, such as capsule endoscopes, can be ingested orally and equipped with miniature cameras to capture high-resolution images of the small intestine. These devices are equipped with wireless transmission capabilities, allowing real-time monitoring and analysis of the intestinal tract. The use of nanodevices for intraluminal imaging enables early detection of abnormalities, such as tumors or strictures, and facilitates targeted interventions for improved patient outcomes. Colon cancer is a significant global health concern, and its treatment often involves surgery, chemotherapy, and radiation therapy. However, these treatment modalities can cause significant systemic side effects and may not effectively target cancer cells in the colon. Nanoscale drug delivery systems offer a promising solution to enhance the efficacy of colon cancer treatment while minimizing off-target effects. One nanotechnology-based approach involves the use of nanoparticles loaded with chemotherapeutic drugs. These nanoparticles, often functionalized with specific ligands, can selectively accumulate in the tumor tissue, maximizing drug delivery to cancer cells while sparing healthy tissues. Additionally, nanoscale drug delivery systems can provide sustained release of the therapeutic payload, ensuring prolonged drug exposure at the tumor site. The utilization of nanoscale drug delivery systems in colon cancer treatment holds great potential in improving survival rates, reducing treatment-related toxicities, and enhancing the overall quality of life for patients. The timely detection of gastrointestinal pathogens is crucial for effective treatment and prevention of outbreaks. Traditional methods of pathogen detection often involve time-consuming laboratory techniques or invasive procedures. Nanomaterial-based biosensors can revolutionize the field of pathogen detection, enabling rapid and sensitive identification of gastrointestinal pathogens. Nanomaterials, such as carbon nanotubes or gold nanoparticles, can be functionalized with specific antibodies or nucleic acid probes that target pathogenic microorganisms. When these nanomaterial-based biosensors come into contact with the pathogen, they undergo a detectable change, such as electrical conductivity or colorimetric response. This change can be accurately quantified, providing a reliable and efficient method for pathogen detection. The use of nanomaterial-based biosensors in gastrointestinal pathogen detection can significantly improve public health interventions, facilitate targeted treatment strategies, and prevent the spread of infectious diseases. Hepatic fibrosis is a progressive liver disease characterized by excessive deposition of collagen, leading to liver scarring and impaired liver function. Current treatment options for hepatic fibrosis are limited, and there is a need for innovative therapeutic approaches. Nanotechnology offers several strategies for the treatment of hepatic fibrosis, including targeted drug delivery, gene therapy, and tissue engineering. Nanoparticles loaded with anti-fibrotic drugs can be designed to selectively accumulate in the fibrotic liver tissue, minimizing systemic exposure and increasing drug concentration at the desired site. Additionally, nanotechnology-based gene therapy approaches can deliver therapeutic genes to hepatic stellate cells, promoting their apoptosis and reducing collagen deposition. Furthermore, nanoscaffolds can be utilized in tissue engineering approaches to promote liver regeneration and repair damaged liver tissue. These nanoscaffolds provide a three-dimensional structure that mimics the natural extracellular matrix, facilitating cell adhesion, proliferation, and differentiation. The application of nanotechnology in the treatment of hepatic fibrosis holds great promise in halting disease progression, improving liver function, and enhancing patient outcomes. Gallstone disease is a common disorder characterized by the formation of solid deposits in the gallbladder or bile ducts. Current treatment options often involve surgical removal of the gallbladder, but this procedure can carry risks and complications. Nanoparticle-based theranostics, combining therapeutic and diagnostic capabilities, offer a potential alternative for the treatment of gallstone disease. Nanoparticles loaded with dissolution agents can selectively target gallstones and facilitate their breakdown. The dissolution agents can be released in a controlled manner, ensuring effective gallstone fragmentation and clearance. Additionally, these nanoparticles can be functionalized with imaging agents, allowing real-time visualization and monitoring of the gallstone dissolution process. By combining therapy and diagnostics in a single nanosystem, nanoparticle-based theranostics hold the potential to provide targeted, non-invasive treatment strategies for gallstone disease, minimizing the need for surgical interventions and improving patient outcomes. The field of tissue engineering holds great promise in regenerating damaged or diseased gastrointestinal tissues. Nanoscaffolds, three-dimensional structures that mimic the natural extracellular matrix, play a crucial role in creating a suitable microenvironment for cell adhesion, proliferation, and differentiation. Nanotechnology enables the fabrication of nanoscaffolds with precise control over their physical and chemical properties. These nanoscaffolds can provide mechanical support to the regenerating tissue while acting as a reservoir for growth factors or therapeutic agents. Furthermore, the surface of nanoscaffolds can be functionalized with specific ligands or peptides, enabling targeted cell adhesion and promoting tissue integration. The use of nanoscaffolds in gastrointestinal tissue engineering can revolutionize regenerative medicine approaches, facilitating the restoration of damaged tissues, improving organ function, and enhancing patient quality of life. Gastrointestinal motility disorders, such as gastroparesis or constipation, can significantly impair patient quality of life and require effective management strategies. Nanoparticle-based drug delivery systems offer innovative solutions for the treatment of gastrointestinal motility disorders, improving drug efficacy and minimizing side effects. Encapsulation of drugs within nanoparticles can protect them from degradation in the harsh gastrointestinal environment, ensuring their integrity and stability until reaching the target site. Additionally, nanoparticles can be functionalized with specific ligands or stimuli-responsive materials, allowing controlled drug release in response to physiological cues. Such targeted drug delivery systems can enhance drug absorption, improve therapeutic outcomes, and minimize side effects associated with conventional oral medications. These nanoparticle-based drug delivery systems offer promising possibilities for the treatment of gastrointestinal motility disorders, enabling personalized and optimized therapies. Helicobacter pylori infection is a prevalent bacterial infection that affects the stomach lining, causing various gastrointestinal disorders, including gastritis and peptic ulcers. Nanotechnology-based approaches can improve the diagnosis and treatment of Helicobacter pylori infection, enhancing patient outcomes and reducing the risk of complications. One such approach involves the use of nanoparticle-based biosensors for the rapid detection of Helicobacter pylori antigens or genetic material. These biosensors can provide sensitive and specific detection, enabling early intervention and tailored treatment plans. Furthermore, nanotechnology can be employed to develop targeted drug delivery systems for eradicating Helicobacter pylori. Nanoparticles loaded with antimicrobial agents can selectively accumulate in the infection site, promoting effective bacterial killing while minimizing systemic exposure and off-target effects. The utilization of nanotechnology in the diagnosis and treatment of Helicobacter pylori infection holds great promise in improving patient outcomes, reducing the burden on healthcare systems, and preventing the development of complications. In conclusion, the field of nanomedicine shows great potential in revolutionizing the diagnosis and treatment of gastrointestinal disorders. Through the use of nanotechnology, conditions like gastroesophageal reflux disease, gastric ulcers, inflammatory bowel disease, and colon cancer can be effectively addressed. Nanoparticle-based drug delivery systems, targeted imaging devices, biosensors, tissue engineering approaches, and theranostics provide innovative solutions to the challenges in this field. The integration of nanomedicine into clinical practice holds promise in improving patient care, treatment outcomes, and reshaping the future of gastroenterology.